Experience the care of Narayana Health.
Hello friends and welcome to Narayana Health's initiative Let's Talk Health. Today we are joined by a dreamer who really thought that cardiac surgeries in India could be made affordable, and he did it by opening the first hospital in 2000. Yes, I am talking about Dr. Devi Shetty, our founder and chairman of Narayana Health. And Narayana Health today not only does India's largest number of pediatric cardiac surgeries, it also does the largest number of bone marrow transplants in India. It also does the largest number of kidney transplant in a single center in our Artix Hospital, Kolkata. Today, Dr. Shetty is here again once more with a vision to make Indians go towards a better cardiac health. So, Dr. Devi Shetty, our chairman and founder. Sir, welcome to the show Let's Talk Health. So, sir, in this initiative of ours, we wanted a better cardiac health for Indians, and today we have no one better who can talk about it. So, we'll start these questions. Request, tell us, you spoke about Indians being more predisposed genetically towards cardiac problems earlier on. Why is that so, sir, and why do you say that?
Indians are genetically 3 times more vulnerable for heart disease. It is a bit difficult to say exactly what the reason is, but one thing is because we have a higher tendency to develop diabetes. We have a higher tendency to develop diabetes at a younger age, and when I used to work in England, the average age of my patient was more than 60. In India, it is 45. In India, it is not the young man bringing his old father for a heart operation. It is the old father bringing the young son for a bypass grafting. It is totally different, the spectrum. And also, we have a tendency to develop multiple blockages. Probably it is genetic, or probably because we have a very high incidence of tobacco consumption, which is adding to the complexity. And as such, Indians are sedentary. We are not very athletic like the Western population. These leads to obesity, and obesity leads to diabetes, and we have a fairly high carbohydrate intake. That is also not helping the matter. So on the whole, we are a perfect recipe for disaster.
So in your career, you've seen lakhs of heart patients coming to you. But if I were to ask you, what are the most common ailments that you've seen which afflict the Indian population? And over a period of time, have you seen any change in trend that you have observed in your long stint with healthcare?
Yes, we have seen perceptible changes. One is, the commonest disease is the coronary artery disease, which affects the coronary arteries, which what you call as heart attack, or the myocardial infarction in medical terms. That is the commonest disease. We used to see large number of patients with the valve disease, which was a disease which was affecting children as a joint pain. Eventually that leads to damage to the heart muscle. That is due to rheumatic fever. Typically, it is described as a rheumatic fever is a fever which licks the joints and bites the heart. And it really bites the heart because by the age of 15-20, these kids have a virtually damaged heart valve which requires operation. But fortunately, as the country is becoming more affluent, we see less and less number of those patients with the valve disease. But 1 out of 140 children born anywhere in the world has a hole in the heart, and we produce over 23-24 million babies a year. You can just imagine the number of children who are born with a heart disease. That is extremely prevalent. So these are the common spectrum of disease we come across.
Sir, almost every day in the newspapers we are hearing death in the gym, a young person running or cycling suddenly falling and dying. It's very unfortunate, but I mean, everybody thinks about, you never thought that this person had a disease, he was leading a perfectly normal, perceptibly a normal life, but suddenly one fine day he goes to the gym and dies. What are the reasons for this trend, sir, that you're seeing?
We constantly use the term called sudden cardiac arrest. Perfectly healthy person had a sudden cardiac arrest and died. There is nothing like sudden cardiac arrest. If these patients had a CT scan of the heart 10 years earlier, their death could have been predicted 10 years earlier. They didn't develop a heart attack just because of due to that moment. The blockages would have started 10 years, 20 years earlier, that will gradually progress. The reason why young people, fit people, athletic people, people who are very, very physically active, they suddenly collapse and die, it's mainly because of the pre-existing coronary artery disease or some other disease of the heart. In India, even across the world, there is a feeling that if I am fit, I am healthy. How you feel has nothing to do with how fit you are. You can stand in front of me saying that I ran marathon in less than 20 minutes or whatever the very, very shortest possible time, and expect me to say that you are a fit person. I will refuse. I will congratulate you for running the marathon in the shortest possible time, but I will never say you are a fit person. For me to declare you are a fit person, you have to get me your blood test report. I want to see your ECG, I want to see your echocardiogram, and I want to see a CT scan report of your heart. If these are normal, then I will say you are a fit person. So, thinking that you can do whatever you want, you are feeling fit, you are on no medications, you have never seen a doctor in your life, that doesn't mean anything. You want me to say you are a fit person, or you do not want to land in the same situation with the sudden cardiac arrest, you have to get these tests done as soon as possible. Every Indian past the age of 30 must go for these tests.
So we'll just continue on this test, because you've been speaking about CT angio a lot, and I think it has to become like a revolution in India, because if a simple test can detect this disease much earlier, imagine the wonders it can do to our population. So we would like our viewers to understand what a CT angio test is. I mean, how much time does it require? And is it a test which is non-invasive and it can be done by anybody? And when does the report come out? And what does that whole test show to a person?
See, these tests were not available just 10 years ago. 10 years ago, there was a CT scan, but that was not very sensitive. Today, CT scans are extremely sensitive, and it takes 2 seconds. All they do is to inject a little bit of a dye, and you have a picture of your coronary arteries, and we can pick up 5%, 10% blockages, and we can predict that if you do not take care of your health, if you don't quit smoking, if you don't control your blood sugar, if you don't control your weight and the lifestyle, we can tell you that you will definitely land with a heart attack within the next 10 years. This can be predicted. So this is the beauty of CT scan. All the other tests will show there is a problem at an advanced stage, but that is too late. We want young people to know whether they have a problem when they are at the age of 30 or 35. Then they can make lifestyle modifications and protect themselves. And this is the beauty of CT scan, and that is today available in virtually every street of this country. CT scans are everywhere, and it is a very safe test. There is some exposure to radiation, but that is extremely small compared to what it was before.
So this program, when we started, it was all about prevention. So we are coming almost to the end of the questions for you. We will talk about lifestyle, about diet. I've also heard you talking about yoga sometimes, about some exercises. So I would want you to tell our viewers, with the lifestyle that we are leading now, and it is leading to many cardiovascular problems, what is your recommendation for a young person? What kind of lifestyle they should be living, what kind of food they should be eating, and what should be they doing in addition to CT angio and the medical things that will put them into a better cardiac health?
I am a very strong proponent of yoga. About 8 years ago, I started developing knee pain. My wife insisted I see a yoga teacher. I refused because I was athletic, I was a bodybuilder, I used to win competition in bodybuilding, I was a karate senior brown belt holder. So I thought, karate, why is it the yoga, why is it for me? But after a while the pain became very bad and I started yoga. And within 3 months of yoga, my knee pain disappeared. Today, if you ask me which of my knee was hurting, I can't even recall. As a bodybuilder, I always used to have some aches and pains somewhere in the body, but once I switched over to yoga, nothing, there is no pain. I always feel fit, I can climb any number of steps. I believe that everyone past the age of 30 at least must practice yoga, because I strongly believe most of the degenerative problem we come across in the joints, neck pain, joint pain, it's all because of the muscle imbalance. Because in the gym, during the exercise, we only train the flexors, not the extensors. And as we grow older, these flexors and the muscles and tendons get rigid, and unless you do exercise to stretch them, it will cause problem, it will cause imbalance in the joint. So I believe that yoga is the best gift this country has given to the society, and I'll recommend everyone to practice yoga. And about the lifestyle, it's very important to use the right food. It's very, very important to prevent obesity. You know what your body weight should be, and everyone should exercise every day in the morning, at least for 15 minutes. But more than anything else, I want everyone to be spiritual. That is very, very important. I'm not saying you should become religious, but you should become spiritual, because in the end, all of us must understand that our life has many, many challenges, many, many problems. Knowing that there is someone up there who is going to take care of you when we are in distress is an extremely, extremely powerful force to stabilize our life. This is my message to everyone. Thank you so much.
Dear friends, I really thought that this show should go on and on and on. There are thousands of questions in my mind, and I'm sure thousands of questions keep coming in our minds, when we are sitting with someone like Dr. Devi Shetty. But yes, today, during this short 5 questions that he has answered, he has taken us towards a little bit of once more a dream that Indians should have a better cardiac health. I'm sure these answers that he has given today to our basic normal questions about our heart will go a long way to making Indians go towards a better cardiac health. Dr. Shetty, patient still is at the center of his life. So if you would like to take an appointment, Dr. Shetty, speak to him, go and meet him. There's a number on the screen right now. It's a WhatsApp number. You can contact them and talk to Dr. Shetty. My request to you once more is to share this video with your friends, spread the message around so that tomorrow we can have Indians who have a much, much better cardiac health in general. Thank you so much for watching this video.
Experience the care of Narayana Health.